Hi, I'm Dr. Sam Dubé. I'm here to talk to you today about the diabetic foot, its symptoms, the underlying issues, and the benefits of different treatment options. The early signs and symptoms of a diabetic foot include pain, discoloration, loss of sensation, poor balance, and a pins and needles feeling. As the disease advances, there is an ever-increasing risk of easy, soft tissue wounds that frequently lead to non-healing ulcers and infections. At worst, chronic infections like these can lead to gangrene and amputations. Concurrent to the soft tissue vulnerability is a very high rate of appearance of notably severe foot deformities such as hallux valgus, bunions, corns and calluses, and hammer toes. The central issue is the progressive loss of oxygenation, which is necessary for tissues to heal. Over time, the diabetic foot follows the sequence of venous stasis, poor circulation, capillary breakdown, and ultimately soft tissue necrosis. So what causes a diabetic foot? All of these issues are worsened by maladapted foot function. Maladapted feet have poor to absent lower leg muscle function, which is essential for venous blood return. These muscles normally act as a muscular pump for venous blood return. Maladapted foot function also exhibits an inefficient, unstable arch system. This instability results in excessive foot movement in a shoe, which creates localized points of inappropriate pressure, rubbing, and friction, creating hot spots that are the precursor to the formation of ulcers. When maladapted neuromuscular function is present, especially concurrent to the metabolic vulnerabilities of diabetes, the serious consequences of deformity and soft tissue necrosis are almost inevitable. For proper function, our feet require right stimulus and the right movement. Right stimulus consists of the varied, subtle stimulus that the soles of our feet receive when we walk, especially when we walk barefoot on natural terrain. With each step, there are subtly different sensations. These subtle differences in stimulus keep our brain on high alert so that our body's protective reflexes function properly with optimum muscle function. When our brain is uncertain about what will happen, it triggers protective reflex muscle activations that support our arches even before our feet contact the ground, to ensure that our feet and legs can safely manage the forces generated by the activity intensity of our bodies. As activity-related stimulus intensifies, a progressively higher arch is created. That's why, when they're functioning properly, our arches and toes rise and fall dynamically in response to the varying activity stimulus intensities. This uninhibited dynamic movement is right movement. Right stimulus and right movement prevent the maladapted neuromuscular function that exacerbates diabetic foot dysfunction. They also ensure optimal muscle function and the corresponding blood flow. Conventional footwear impairs optimal foot function in two ways. First, most conventional footwear dampens right stimulus. This is particularly true for shoes or insoles that support or cushion our feet. They spread the forces evenly across the soles of our feet, creating sensory input that's muted and repetitive, step after step. Within a short period of time, our brain tunes out the stimulus and simply stops responding to it. As a result, our brain doesn't sufficiently activate the muscles that stabilize our arches and properly align our feet, legs, hips, and lower back before our feet contact the ground. This tuned out brain response is natural, and it actually happens all the time. The same thing happens when we walk into a room and first smell the coffee, and then after a few minutes, we don't notice the smell at all. Second, most conventional footwear, especially footwear that's tightly laced, has snug toe boxes or stiff midsoles or outsoles, restricting the right movement dynamic raising of the arches and toes that is just so critical in the creation of a strong, stable arch system and healthy linear propulsion with the toe-off forces spread across the forefoot. Tight, restrictive footwear also hinders peripheral circulation, leading to compression, friction, and sites of tissue stress, which can lead to non-healing wounds. For the diabetic individual, impaired right stimulus and right movement will notably increase the risk of foot deformities, inadequate blood flow, and non-healing wounds. Conventional treatment methods for the diabetic foot include the following: supportive products such as orthotics, taping, meticulous cleaning, drying, nail trimming, etc., the use of rigid protective footwear, avoidance of barefoot walking, and surgical procedures. Now, while these methods may temporarily alleviate symptoms, they don't address the poor neuromuscular function that is the real cause of the problem. In fact, the more we artificially support or cushion our feet, the weaker and the more dependent we become on these types of products. These old school support and cushioning treatment methods are not recommended in any other area of musculoskeletal medicine as a viable long-term treatment option. In fact, today's modern treatment methods for poor neuromuscular function focus on increasing mobility, muscle strength, and proper alignment via proper technique exercise, which requires both right stimulus and right movement. Science has shown that simply challenging the body to do its job is the best way to restore and enhance function. This principle is the foundation for virtually all of today's sports training and rehabilitation programs. To address the poor neuromuscular function that exacerbates a diabetic foot and helps prevent it from recurring, I recommend the following: walking barefoot on natural terrain such as a sandy beach or on grass as much as possible. This provides the optimal right stimulus and allows for the right movement required for healthy neuromuscular function. To obtain right stimulus in your conventional footwear, use BioPods stim soles. For best results in conventional footwear, use BioPods stim soles in loosely laced, soft, flexible footwear that allows your arches and toes to rise easily. For optimal neuromuscular function while wearing shoes, use BioPods footwear, which are specifically designed to provide the right stimulus and facilitate the right movement that optimize and encourage healthy foot, leg, hip, and back function. Consult with your healthcare practitioner and ask them about employing soft tissue mobilization therapies to address the fibrotic scar tissue that may have formed in the past.